Hey everyone, welcome back to all my listeners. Hope you're all having a great day so far. And if it's your first time finding me, thanks so much and welcome. Welcome to episode 1 of my 4th season. Today is Wednesday, September 1st, 2021. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Yep, that's right. I'm starting a brand new season just in time for my 2nd year in podcasting. I'm looking forward to all the newsworthy news updates I share with you, from my tried and true OIG work plan updates and my focused month-end fraud, waste, and abuse series, as well as my special guest conversations and spotlight topics. And of course, my trusty tips will still come in handy, I hope, for all of you, since I'm all about compliance and wanting us all to do better. This season's Spark will also focus on illumination. I really enjoy curating all the season's sparks, from Season 1's change to the greatness and possibilities in Season 2 and Season 3's journeys. I really hope you'll keep following me and supporting this podcast series because I love providing all my listeners with valuable content that I hope you can use in the everyday work you perform, and that may inspire you to propel yourself onto a whole new level. Now, I wanted to give my special shout outs to all my LinkedIn friends and followers who continue to provide their likes, loves, insights, and comments on my daily posts. They inspire me and converse with me online and offline, daily, weekly, monthly, and continue to support me year after year. So I wanted to thank Karen and Kate and Kimberly and Glenn and Jennifer and Terry and Rosemeen and Lori and Matthew and Sean and Jordan and Natasha and Whitney and John and Brian, Tony, Jenna, and Victoria. Amazing. There's so many more of you. Hopefully I'm going to get to all of you in all the episodes to come. Now, in my compliance tip today, I'm going to be diving into a brand new comparative billing report for the impact of the PHE on telehealth. And I also discuss highlights and actually want to start off Season 4 celebrating some good news finally, right? I'm going to be unpacking the recent hefty monies received. No takebacks, no clawbacks here, because it involves all the big funding telehealth received. And I round out today's episode with a remarkable quote on illumination from Sir Francis Bacon. If you've checked me out on LinkedIn, you know I'm all about compliance and protecting our physicians and valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve coding accuracy as you help your providers paint the medical picture. If you like what you're hearing, go ahead and hit that subscribe button now so you don't miss another episode. Please write in a review and kindly drop me a 5-star rating on Apple Podcasts or wherever you listen to my podcast. Oh, and by the way, I'm now on Amazon. So hip hip hooray, you can find me on Audible, Amazon Music. So let's go. That's one more podcast platform for me. That's awesome. So I'd really love your support wherever you can find me. And as always, a friendly disclaimer. Remember, I'm bringing you the news, current healthcare industry news, my compliance tips and recommendations based on my over 10 years of experience in front office, back end, coding, and billing for multi-specialty physicians, compliance, and auditing for both E&M and surgical operative reports. These are my opinions alone and are not to be construed as legal advice. So, let's get into Newsworthy. Now, I wanted to kick off Season 4 with some celebration, some good news for a change, right? So obviously this pandemic has hit us all, changed all of our lives, and especially in how we can now receive our healthcare. And guess what? There's almost 88% of Americans who want to continue using telehealth for non urgent consultations after the COVID-19 is long gone. And fingers crossed it will be, right? And this is according to a March Sykes survey that polled 2,000 Americans on how their opinions on virtual care have changed within the past year. Now, the Federal Communications Commission, the FCC, recently announced 62 award winners for funding commitments totaling nearly $42 million dollars as part of the second round of its COVID-19 telehealth program. Now, I hope you can hear me smiling from ear to ear because that's huge, right? $42 million dollars awarded to telehealth programs. Wow. Now, these awards ranged from roughly $100,000 to up to $1 million to fund programs to acquire, network improvements and connected devices, as well as implement telehealth programs for patients whose incomes are below the federal poverty level. Now, I'd love to highlight a few of them here. I don't think I have time to go over all 62 award winners, but let's get into a few. So there's the Mobile County Health Department in Alabama, who was awarded just over $800,000 to purchase remote patient monitoring equipment and a telehealth software platform. There's also the Southeast Alaska Regional Health Consortium, obviously in Alaska, who was awarded just over $800,000 for equipment, including telemedicine carts, web services, tablets, and video conferencing software to help create and promote a telehealth program that will provide care to communities spanning an archipelago of more than 375 islands. Many of those islands, of course, are accessible only by plane or boat. So the monies will help maximize patient access while minimizing in-person contact and risk of the virus transmission. Now, there's also the Norton Sound Health Corporation, also in Alaska, who was awarded just over $400,000 for home health care kits and mobile devices to provide enhanced remote care management to address the barriers of providing healthcare services to patients remotely. Then there's also the LBJ Tropical Medical Center in the American Samoa, who was awarded just over $300,000 for telehealth equipment to facilitate consultations and remote ultrasound sessions with OB/GYN specialists, as well as follow-up visits with patients unable to visit in person, obviously because of the COVID-19 virus. Now, there's also the Tafuna Family Health Center in the American Samoa, who was awarded just over $100,000 for telehealth equipment to provide contactless primary care, dental care, women's health care, pharmacy, and pediatric care. Then there's also the Tuba City Regional Healthcare in Arizona, who was awarded $260,000 to purchase internet service, as well as a mobile telehealth clinic and telemedicine carts and cell phones, all to bring healthcare and to connect patients from the Navajo Nation in remote locations. Now, there's also the University of Arkansas for Medical Sciences, obviously in Arkansas, who was awarded just under $1 million to purchase telemedicine carts for emergency departments, labor and delivery units, and clinical spaces at a range of rural, medically underserved healthcare locations. Then there's also the Los Angeles Jewish Home for the Aging, obviously in Los Angeles, who was awarded just over $800,000 to purchase telehealth carts, Wi-Fi extenders, mesh networks, and tablets. Then there's also Peak Vista Community Health Centers, which is an FQHC located in Colorado, who was awarded just under $1 million for devices to provide medical and behavioral health care via telemedicine. Now, there's also the Community Health Center in Connecticut, who was awarded, again, just shy of $1 million to purchase laptops, monitors, and other equipment to enable healthcare providers to communicate with patients and provide telehealth services. There's also the LA Red Health Center in Delaware, who was awarded just over $285,000 to purchase again tablets and data plans, Bluetooth enabled self measured blood pressure devices, Bluetooth enabled glucometer starter kits, and much more. Then there's also MCR Health in Florida, and they were the big winners. They were awarded $1 million to purchase laptops, microphones, cameras, monitors, smart TVs, and telehealth carts and kiosks to enhance the provision of telehealth services during the pandemic. Now, there's also the Georgia Primary Care Association, another consortium of FQHC centers throughout Georgia, and they were awarded just under $1 million for remote patient monitoring devices to help track and provide greater visibility into patient health care that will help clinical staff quickly identify conditions or changes and support these providers in providing quality health care. Simply amazing, right? I wish I could go on, but maybe I could come back to this another time. But bravo to all 62 award winners. I'm sure you're grateful that you applied and received the money. Looking forward to it, right? Amazing. And now it's time for my best practice tips in Trusty Tip. Okay, so there's yin yang to everything, right? I just unpacked the good news in Newsworthy for telehealth funding. But on the flip side, the latest comparative billing report, or CBR, is issued on telehealth, the impact of telehealth during the PHE. Now, this is going to be found in our CBR number 202108. Now, that's the 8th CBR for the year to date. Now, we cannot forget that CMS disseminated guidance about billing for professional telehealth services during the PHE in the early months of the pandemic and changed or revised guidance almost, it seemed to me, in my opinion, every third day, because I remember how many webinars and presentations I gave myself or others I trust. I sat in on their webinars and presentations, and things were changing all the time. We were updating like mad fiends, and we simply knew even then that telehealth services would later be investigated and audited and looked at more closely. And we are here now, right? We are here. But I digress. So let's get back to the CBR. So remember, back on March 31st of 2020, there was a release of a special edition MLN Connects that provided guidance. And then they updated more guidance on April 3rd, 2020 in yet another special edition MLN Connects, which states, quote, building on prior action to expand reimbursement for telehealth services to Medicare beneficiaries, CMS will now allow for more than 80 additional services to be furnished via telehealth. Now, providers should bill with the place of service equal to what would have been the place of service had it been in person, had the service been furnished in person. So for the office, remember that's place of service 11. And then providers should also be billing with a modifier 95, which indicates that the service was rendered via telehealth, end quote. Now, they're also going to be looking at our specific CPT codes in the range of 99201 through 99205 for office or other outpatient visit, new patient, as well as our CPT codes in the range of 99212 through 99215 for office or other outpatient visit, established patient. Now, this particular CBR is going to be analyzing the following elements: rendering providers, of course, that submitted their Medicare Part B claims with the CPT codes that I just stated, with the addition of that modifier 95, as well as, like I stated, place of service 11 for the office setting. Now, their particular scope is honing in on days of service from January 1st, 2020 through December 31st of 2020. So that entire calendar year. Now, some of the rationale behind receiving this particular CBR 202108 is that the provider is in the top 5% of providers by claims volume within the top 25 specialties for the submission of CPT codes in the range 99201 through 99205, as well as 99212 through 99215, again with that modifier 95 and that place of service 11 during the PHE. Now, it's critical to understand that a CBR does not indicate you are going to get an official audit. Although please be mindful, and I've said this in so many of my CBR updates in previous seasons, be mindful that this phrase is directly coming from the MACs, directly coming from the Medicare administrative contractors that issue the CBRs. So take that with plenty and plenty and plenty of grains of salt. More directly, consider this your notice, your warning that you are being looked at closely. Now, the value of the CBR to providers is that it will serve as a tool, right, to look at your billing patterns as compared to your peers. The value also includes the facts that specific coding guidelines and billing information will be detailed. Now, the CBR informs providers whose billing patterns differ from those of their peers. Now, the desired behavior here is obviously to capture proper and compliant documentation for services, right? But remember, as I alluded to, my opinion is that we were giving guidance all the time. Things were changing. So I understand that perhaps practices couldn't catch on quick enough because we were also issuing addendums to our own PowerPoint presentations. We were giving the new guidance as quickly as it flew out the door. So I understand. But now Medicare is looking. They want to see what's been going on. And some of those hot button items might be the patient consent. Remember, back in the day, a year ago, we had to start obtaining patient consent for telehealth, which means how is this service being rendered? Are you okay with doing it audio visual? Two-way communication, right? Are you going to be doing the visit via FaceTime or Skype or a telehealth platform like Doxy.me? There's so many hot button items from a year ago that I'm pretty certain Medicare wants to review. So that consent, that mode of communication, those are going to be some hot items, as well as that modifier 95 and the place of service 11. These are all huge items. So I don't think this is going to end. This is probably a beginning for the types of telehealth services, as well as telemedicine services that are going to be audited. But I know, in my opinion, again, I've been seeing a lot of really, really great documentation for telehealth services in the work I do currently. So as of recently, our practices are now in the swing of compliant documentation and therefore compliant coding capture of telehealth services. So I hope CMS will go easy on those telehealth claims for 2020. Like I said before, there was so much changing guidance, so much on provider plates already. Fingers crossed, I hope they tread lightly for these top 25 specialties receiving this CBR. So in this instance, I hope providers are in fact doing better. We must be mindful that our provider's clinical documentation is capturing complete accuracy of the patient's medical condition. If the documentation supports it, telehealth services can be easily defended and the monies can be retained. So, a better, smarter approach is one that's proactive and starts by painting a clear, rich, and vibrant medical picture the first time, so your certified medical coder can then abstract codes with accuracy. And finally, in this week's inspiring quote in Spark is from Sir Francis Bacon. In order for the light to shine so brightly, the darkness must be present. So very true, right? I think this is a perfect quote that reminds us on how illumination really works. We all have that light, that brightness within us, just as we all have and experience the darker side, the negative side, the uphill battles, the naysayers. But for that brightness to really shine, there must be that trigger, that yearning to do more, get more, be more. We all want to escape the negativity and aim for something higher, for something brighter. I'm happy Sir Francis Bacon's spark still shines on in all of us today. So that wraps up today's episode. Please go out and make this a great day, an incredible week for yourselves. Aim a little higher, do a little more, and give back in any way you can in 2021. There's so much each one of us can do. Now, I know this Delta variant is so aggressive, spreading from state to state. The numbers are still climbing, even worldwide. Now, I know it's hard. This new normal is really hard, but let's continue doing our part and keep washing up, masking up, and staying physically distant. As always, I appreciate you diving into today with me. And if you want more information from me, go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. Please continue staying safe and healthy. Practice safety for one and all during our collective, seemingly never-ending time and life of coronavirus. Thank you for listening in on today's episode and helping me start out my second year of podcasting. I hope to see you every week, bringing you closer to helping your providers paint a masterpiece. See you next Wednesday.